We are going to break the silence on the drug that many women usually use, but few understand. Now, basically, duphastone is not a magic fix, and it's a hormone. It's a hormone that must be respected, and we have to learn about it more. So, basically, I would like to take you through about duphastone. Actually, duphastone is a synthetic progesterone, and it's usually used to support pregnancies, regulate menstrual cycles, and usually it's also used to treat hormonal imbalance. And actually, to clarify this, that duphastone is not a contraceptive, or it's not an abortional pill. You have to know that. And question that comes into mind is that we already know what is duphastone, and I've already told you that it's synthetic progesterone. But question in mind that comes is, how is it usually misused? Now, basically, people usually misuse this drug by starting it on day 1 of bleeding, which is usually not correct. Also, using it to delay period without diagnosis, and taking it during unknown pregnancies or self-prescription after miscarriage. But what's the correct use? How can you correctly use duphastone? Duphastone starts to be used on the 14th to 25th day of the cycle, unless otherwise it's advised. And the dosage is usually 10 milligram OD or BD, depending on the condition of the patient. Now, it's important to always confirm. It's usually important to confirm that there is no pregnancy before starting using duphastone, and never use without a doctor's guidance. That's very important thing that you have to consider. Basically, there are known side effects usually which occur after when using duphastone. Specifically, you might experience headaches, nausea, now breast tenderness, and also irregular bleeding if it's misused. You have to consider this when it is misused, and the risks of masking incomplete abortion. But